Okay, let me see if it's up in the group.
Okay.
Okay, yes, it's up in the group. We are back. Okay. Sorry it took so long. I had to figure out this Facebook technology stuff. So, okay, guys, once again, Nurse Renee here in the nurse study group, New Nurse University study group, and we have our guest interviewer, Miss. You want me to say your real name?
Nurse Kodi is just fine. I'll
Okay,
take
the Nurse Kodi. um, let me know if you can see her face. Okay. Um, please get your questions ready and keep them until the end. But you can put them in the comments. Okay. But we will address them at the end. So we got to get through all our material first for our interview. Okay, I think you're okay. There you go.
had to do a little minor adjustment.
Okay. Okay, so we have our people coming in, and we're gonna get started because we've been delaying this long enough. Um, so tell us about yourself. Tell us, first of all, what made you want to be a nurse?
Oh wow. Now that's a hard question.
Now you knew that
No.
question was coming.
What made me want to be a nurse? Well, actually, when I first went to school, I did not want to be a nurse. I wanted to be a sports medicine doctor.
Oh wow.
But that's a lot of schooling.
Okay.
I was a little impatient. And my
Okay.
mom's a nurse and my dad's a nurse. So they have to be my main inspiration, I would say.
Oh, so you got role models,
I
and you talking about
do.
something you don't want to be a nurse.
Because, growing up, they're like, are you going to be a nurse like your mom? And it's like, no, I'm going to be a doctor. And it's like, now that I'm a nurse, I'm like, nah, I'll just stay a nurse.
Stay a nurse. And it's so funny because I never wanted to be a nurse either. I tried everything else under the sun, and then
Yep.
just found that I was helping everybody else. I'm like, I might as well be a nurse.
Yep. That's exactly how it went.
So, okay. So you have a mom and a dad that's a nurse. That's inspiring.
Yep. My
That's
mom
inspiring.
is a registered nurse, and my dad was an LPN.
Okay.
And he had done it ever since he was 19 years old, up until
Wow.
past that 45. Yep.
So he got many years of experience. That's nice.
Oh, yes, most definitely. And see, that was back in the era where they allowed LPNs to be like in trauma and ER,
Hmm.
things like that. So, he really, he really got all the experience. He actually taught my mom.
Oh,
So,
wow.
yeah, yeah.
Okay, so they're saying that your face is cut off still.
Oh, it is. I'm sorry.
Yeah.
Is it not?
So put it up some more.
Okay. Is this good?
Let me see, because it's a delay in Facebook. There
Oh,
you go. I think
am I
so.
good? Okay.
Okay.
Sorry.
Okay. So tell us how you got started. Did you go to CNA school first? Were you an LPN? How did you
I
get started?
did. I did. I went to CNA school first. I never got my license as a CNA, but
Okay.
I went and I did home health aid.
Oh,
And
nice.
so as I was doing the home health aid, I had a situation where the caregiver's daughter was very, very rude. And she
Mm.
was telling me, like, you're never gonna be a nurse, you're never gonna be a good nurse, you're a horrible aide. I think what it more so was is that the connection that I had with her mother was a
Mm-hmm.
little bit more
She
stronger. So
Oh, she
I
was
think
like
that
the
was what,
jealous type.
yeah. So after that case closed, that's when I went to school.
Okay.
Yeah, that's when
Okay.
I went to
And
school.
see, I never tell people that like you're never gonna be a good nurse or nursing isn't for you. Like I'm just not that type of person. I think you should never say that to somebody as long as they're trying. You know what I'm saying? I mean,
Right.
what's for them is for them. If they don't get it, they don't get it. But that's not for me to say, like, oh,
Right.
you not gonna be a good nurse. Like,
Right.
no.
No judgment zone here. You know, like I always try to keep people encouraged because you never know what walk of life they come from.
Exactly.
You never know when you're going to see this person again. You know, you never know. They may be your nurse, you know, so you just have to
Exactly.
always treat people accordingly.
And stay humble, right?
Yes, absolutely.
Okay. So, what was our next question? So, you said you started as a CNA,
Yes.
but you never got the certificate actually.
Never got the
Um,
license. Just graduated from the program. It was 2 weeks. And then just went ahead and did home care.
okay. Did you like it?
I did. I really liked home care. I think that was probably one of my best jobs in my nursing career because I went back to it as a nurse as well. So
Okay.
I loved home care. I think it was more so just that one on one with the patients, you know, being
Mm-hmm.
able to talk to them and things like that,
Definitely.
and spend more time and actually do nursing care
Mm-hmm.
instead of having 35 patients and feeling rushed.
Right.
Hmm.
Okay. So, how did you advance from there?
So when I started out totally with BSN.
Hmm.
And I went to school. At that time, I had a baby, had a little
Okay.
baby boy, and I went to school and I did all the prereqs, took the test to get in, had like a 3.9 GPA, and I didn't get in the program.
Wow.
Oh,
That's
I didn't get
crazy
in. I was
competitive.
ready. Oh my gosh, it was really competitive, and I was really upset about it. I was kind of like down in myself, like where did I go wrong, you know?
Mm-hmm.
But then I just kind of said, you know what, let's just take a back road to this. So someone introduced me into the LPN program. And I said, well, my dad was an LPN, so this kind of got to be the same thing, you know?
Right.
So I
Right.
went ahead and did the 12-month program. After the 12-month program, I graduated and I just started working. And it was new to me. You know, it was so
Mhm.
new. And this is something that I actually tell my students, you know, don't get, if your goal is MSN, go get your MSN. Don't get stagnant and stay kind of, like kind of in that shell because we kind of
Right.
become victim, to just working and oh, this is new, everything's new money, new atmosphere, new position.
Mhm.
So I always tell people just continue, go, grow, and everything will fall into play.
Right. Okay. I know about that new money. When I first got my first check, I was like, "Oh
Right,
my
like what
God,
is
what am I
this?
gonna do with all this
Never seen this many digits. Yeah,
money?"
that's exactly how it is. And I went and I stayed in LPN for 6 years before I went back.
Oh, nice. Okay.
Yeah, yeah. So in the midst of that, I had another kid. It was just things, all the dynamics that went with it. So
Yeah.
that's why I tell people, like, you become stagnant, you go ahead on extra baggage. So just make sure you just go ahead and all right, boom. Here's step one, step two, and right on
Right. Okay. All right. All right, Miss LPN.
through.
Okay. So, I mean, it's just so funny how all the like the nurses have so many different backgrounds of
Yes.
how they became a nurse.
Hmm.
Um, okay, so LPN for 6 years, you got that experience in. At what point did you decide, hey, I want to further my education and become an RN?
Well, I saw all of my friends that I went to school with was going back to school.
Okay.
And of course, that was gave me the motivation I needed to go.
Peer pressure,
Um,
peer pressure.
yes, on top of working in a long term care facility doing RN duties and not getting compensated and putting myself at risk is what
Mm,
really made me go back. And I think it was when RN, BSN at that, told me to go
hmm.
start an IV on a patient. Now, see, here in Michigan, LPNs can't start IVs.
Okay.
But I had the experience of starting one, and I was IV certified from Ohio. So I did it out of my scope of practice, but I did it.
Mm,
But I said to myself, why am I doing this? And I'm
right.
not, getting the credit for it.
Hmm.
So that's kind of what was the kicker.
Wow. Okay. Y'all hear that? She was practicing out of her scope of no. Out of her scope of practice. But you know
Yeah.
what? Those be the wake up calls to be like, you know what? Nah, this is not good. I worked too hard for my
Hmm.
license. Like
Yeah.
I gotta do something different. So yeah, those be the wake up calls that we need to be like, hey, maybe I should be doing something else. This is not working out. So okay, understandable, understandable. So you got your RN.
Mhm.
What was your first nursing job as an RN?
My first nursing job was LTAC.
Okay.
That was my first nursing job. And it was not homely at all. I guess that's the
Mm.
right word I'm looking for. I got eight. You know, nurses eat their young, man.
Dang.
Oh man, they gave me the worst. And but I thank them for it because it made me stronger.
Okay.
Made me more knowledgeable.
Not
Uh,
homely at
I
all.
was
I guess that's right. Sorry, I clicked on Facebook on my phone.
so I really was interested more so in like learning new things, and I kind of just taught myself for the most
Hmm.
part. It's kind of but it was good though. It was good. I really I really appreciated the experience.
Okay.
And from there I went ahead and did I floated a lot in the hospital, and till I had to go to OB one time, and I was like, yeah, I don't want to do that. Every nurse
Everybody say
has
that.
their own neck. Like
They
if you are
do.
OB, you are OB. Like that's
Yes.
so, and that's just not me.
It's so funny because my cousin calls me a crotch nurse, and I'm like, listen, I'm a baby catcher. Okay, get it right.
There you go. That's what it is.
But a lot of nurses, they just do not. They either fall in love with it or they hate it.
Yep, that's true. And my
So,
mom is a 35-year vet in OB. So
wow. Okay.
yeah.
Kudos to mom. That's what's
And I spent a lot of time at Hustle Hospital with her,
up. Hmm.
and shadowing. And I'm surprised I didn't fall in love with it, but it's really not. It's not
Just
my
not
thing.
your thing. Just not your
Mm-mm,
thing.
not
We
my thing.
get it. Okay, okay. So, what made you want to be an entrepreneur?
Now that's a good question. I didn't want to be. I was scared.
Really?
I was very scared. I was talking to one of my good friends, and she said, "Why don't you start tutoring?" And I said, "Start tutoring? Nobody gonna listen to me. Tutor for what?" And she's like, "You should." She's like, "Because throughout my career, I've always was like a preceptor, or I was assisting the nursing students when they came in from different schools in their clinicals and things like that. And I always helped out when I was in school. So um, I started tutoring, and
Okay.
it was a door to door thing for the most part. Um, Up until I said, okay, well, let me take it a little further. And I really didn't know how far I was going to go with it, but I just kind of stepped out and did the best I could. So, and it's been
Okay.
going well.
Good. Okay, so now what do you tutor?
Oh, I have a vast amount of subjects that I tutor for. So I'm with you from start to finish. I
Okay.
do
I like that. Me too.
entrance exam, the TEAS test,
Mm-hmm.
tutoring, HESI. I do various subjects within the program. I also do NCLEX prep as well, and I also do exit exam prep. So
Okay.
it's
All
kind of just
right.
a wide span, yeah. And people often ask, like, how are you like good with the math and the TEAS test is like a horror film for everybody. So
Yes, I get a lot of
they
students that ask me about the teachers. I'm like, that's not my area of expertise.
but my dad was more of like an A is passing, a B is failing in our household. So we
Okay.
had to make sure that we knew our math and sciences and English and reading. So that's kind of where I got it from.
Okay. All right. Nice. Okay. So, with that being said, what events do you have coming up?
So I did start a platform, scholarship platform called Destined for Greatness, and this platform is to allow students to get funding for school.
Oh, nice.
I've done a total of two events so far. I just started it in June, and my first event in June was called Nursing Documentation. So we had a few of baccalaureate and master level nurses come out and talk about proper nursing documentation. It was also more of a vendor event too. So I was able to extend an invitation to local um, businesses that came out and did some vendoring. And the last event that I did was in October, and
Okay.
that was a nursepreneur workshop, and we gave away
Hmm.
$1,000 scholarship.
Wow.
Yep, so it was really nice, and we had a special guest, Nurse Mo. She was there,
Oh,
and
nice.
yes, she came out and spoke and gave her take on going from being a bedside nurse to being an entrepreneur. So it
Okay.
was really nice. Yeah, we had a good time.
Okay, nice. All right. So there is the option of being an entrepreneur nurse, you guys. So don't count it out. If you get stuck or if you get burnt out at the bedside and you want to do something different, just you know, you have to explore your options and whatever you're passionate about. So Nurse Kodi, you said you wasn't passionate about nursing, but you just gave it a try and you fell in love with it,
Yeah,
right?
absolutely. Yeah.
So that was the same thing with me. I started tutoring classmates and I was like, if my classmates are struggling, they have to be like a whole bunch of other people struggling too. So
Mhm.
I found everybody on Facebook. And so you're going to be hearing more from Nurse Kodi. She is in our study group. She'll be helping us along. Okay. She's a tutor just like me, as you heard. And she specializes in the tease test. That's how I see her. Like she's the tease queen. And she does everything that I do so she can relate to all of us and what we're doing here. And it's so I feel so good because I have finally have somebody to like collaborate with who understands what I go through.
Yeah, I
Students.
understand.
So she is based out of Detroit, Michigan, but she does travel. Okay.
Yeah.
And tell them where, if they need help, where they can find you.
So you can find me on, I have a group on Facebook. It's Tutor Me Nurse. And then I also have, if you're an Instagram user, I have Tutor Me Nurse RN. And I drop a lot of different questions and posts coming out. Just like random questioning, things like that. There's some videos on there that could probably help you out as well. In the new year coming soon, we're going to be doing some exciting things. I'm not going to drop any gems just yet,
Oh
but
yeah.
stay tuned because it's going to be a lot of good stuff that's going to help you out. And we're also, for the Atlanta area, we're having another scholarship platform that is going to be actually. Oh, excuse me, 1 second. Sorry, having a connection issue. So we're having another event in Atlanta. It's going to be another Destined for Greatness event, and
Okay.
we're going to be giving away a $1,500 scholarship.
Oh,
And
nice.
that event is actually going to be talking about my major, which is mental health. I am a mental
Oh,
health nurse. So we're
okay.
going to be talking about suicide awareness, depression, opioid addiction, domestic violence, things like that. So,
Oh, nice. Okay, so you heard her, guys. Atlanta 2020. So you're going to be look out for the post that I post in a group or on a Facebook page. You can connect with her on TutormeNurse. We have some collaborations coming up as well. So she's not going anywhere anytime soon. So let's see if we have any questions. They said we love you already. Let's see. I think somebody. Oh, okay. So Chanel Monet, she's asking. She says, "I'm having a difficulty time finding my niche. What do you have? Any words for her?"
yeah. So our she's a nurse. I'm assuming, right?
Yes.
Okay. So what I did, and that was my thing. I was kind of like a job hopper. Um, Agency is really good if you have your, at least your year experience in, you can get into an agency, and agency will place you in different areas. And the beauty of it is that you don't have to stay there. You're not locked into any type of contract or full time schedule or anything like that. So you can just pick up here and there, and then you can find out maybe this is something that you want to do. Because sometimes what jobs will do will saturate you with all these orientations, and
Mhm.
you won't be able to kind of like find out if this is really something you want. So
Mhm.
I found my niche out when I did mental health and I floated in a psych hospital, and I was like, I'm there.
Oh, good.
Yeah, so I think that's the best thing to do as far as that for right now.
Okay, good information. Good information. What else? Somebody said, How can I start a business as a nurse? That's a loaded question, honey.
Ooh, that's a large one. So, first thing you could do is come to our annual business shower that we will be having in October of 2020, where we're going to be giving away a $2,000 business blessing to assist you with that. But in the meantime, in between time, attend different events. They have a lot of things on Facebook that are business savvy for startups, and you want to attend those events, especially the ones that talk about establishing business credit and things like that, because that will help you along the way.
Okay, so your face is cut off again.
Oh,
If you could.
can you see me now?
Up, up, up.
Up. Okay.
Yeah.
How's that?
More.
Okay. Sorry.
There you go.
Good. Okay.
Okay. Okay, all right. So yes, there are many different events in your area. Sometimes if you go to the library, there's like a list of people that come out and will do business workshops in your area at the library for free. Okay, so there's always free events. You can go to Eventbrite and see what business entrepreneur meetups are in your area, because that's how I started out, was
Yep.
networking with everybody in the community, getting
Pop
business
up shop.
cards. Yes. Um, so until you like really find what you want to do, and then once you find what you want to do, you absolutely want to like brain dump and write out all your ideas on paper, and then kind of like systematize it. Okay, like write an outline and research the industry. Okay, because it's not all glitz and glam. With glitter's not gold. So it's a lot of hard work starting a business, but if you're passionate about it, it will not feel like work at all. Oh no, I think Kodi is frozen. Oh, Kodi, come back to us. Okay, guys, I think she's frozen. She might hop on in a minute. She might hop back on, but I hope this was helpful for you all. This is something new that I'm trying to, instill even in our group, because I think you guys need more than just me talking to you all the time and, fussing and study this, study that. So I think it's a good idea to have like a fresh new face in the group and community. So thank you guys. I want to thank you guys for joining us. Nurse Kodi says she got kicked out. Here she comes.
Am I
All
back?
right. Yes. Hold it up some more.
Okay.
There you go.
All right. Cool. Sorry about that, guys. Technical difficulties.
Yeah. So I was just telling them that okay, we can't see your face anymore.
Can you see me now?
Up, up, up. There you go.
All right.
Okay. So I was just telling them that they need a fresh new face in the group. Aside from me telling them stuff all the time. I think they sick of hearing me. But we are definitely going to have more collaborations. You guys know where to find her. She has some events coming up, so stay following her on her IG and on her Facebook. If you have any questions, email her. But definitely get more in tune and start nursing networking. Okay, start networking with your nurses. You don't have to be a nurse to network with a nurse and have them in your community of your network. So I encourage each and every one of you to definitely start reaching out to other nurses and seeing if you can get mentors too. So anything to add, Nurse Kodi?
Mentorship is really good, especially if you're in the program. You want that. You want somebody to be able to walk with you while you're in the program, especially when you get out, so that way you won't feel like you're lost. Because a lot of programs are just pushing people through.
Mm-hmm.
And that's not what we want. So definitely network, definitely get with people, talk, collaborate, email, meetups, coffees, brunches, however, that's the best way to do it. And then it helps you mentally too. I'm all about mental health. So It will help you mentally because we can go there.
Oh yeah, definitely. We see all these Facebook posts about nurses committing suicide, nurses eating their young, nurses getting dragged on Facebook. Like it's a whole mental vibe.
It is.
For
It
real.
is. It's
And you
very,
gotta stay true to yourself, so you
yes,
won't lose yourself.
for sure.
Okay, guys, we're not gonna keep you. Thank you for joining us.
Thank you for having me.
And that will be it for today.
Okay, until
All
next
right.
time.
All right. See you guys later.
See you later.